Thank you very much. I want to bring up Director Bishop now to speak about what his department is doing in this area.
Good morning.
Good morning.
First of all, I'm appreciative to be here, and I appreciate the invitation. And as I look out amongst most of you all, I know most of you all have worked with most of you all in trying to carry out this mission of strengthening youth, strengthening families, and subsequently strengthening communities. And that's our mission. I am the director of the Illinois Department of Juvenile Justice. And just to give you a little quick backdrop on the Department of Juvenile Justice and the work that we're talking about today. When I was appointed as director by Governor Quinn in August of 2010, it was following his issuance of an executive order in April of 2010. And basically, his executive order said this: we need to start to treat these young men and young ladies that are in our juvenile justice facilities not as adults, but treat them as the youth that they are. And that treatment means that we need to enhance, provide appropriate vocational, educational, independent living skills, began to engage with families. But when I accepted this position, I looked at the 1899 Juvenile Court Act, and it basically said the same thing. And so what we're doing today is not really new, but I'm happy to say that it's more enhanced, it's more improved, it's more collaborative, and there's more of a focus. And Lisa indicated that our mission is to try to refine what we're striving to do so that we can leverage not only dollars, but also resources. And so again, I came aboard in August of 2010, coming from the Department of Juvenile Justice, and much of the families and many of the families and many of the youth were same or similar. They were sitting at a different address though. And so now, many folks call the Department of Juvenile Justice the deep end, and I'll accept that, because that means that the front end stuff hasn't worked, and youth tend to end up in the Department of Juvenile Justice. And Director Malik indicated that Illinois, or the United States actually, incarcerates more youth per capita population than any other country. I think it's about 383 youth per 100,000 youth are locked up in the United States. And so when I accepted this position, I said we need to look at this work not as just the work of the Department of Juvenile Justice, but look at it as a continuum. I'm totally in agreement with, work with, actively involved with trying to divert and prevent youth from coming into our system. But sadly, some are going to cross the threshold of the Department of Juvenile Justice, and then the question is, what do we do with them? The question is, the predominant number of youth that come into our system are going to come back to your community and my community at some point. So the question is, how do we want them to come back? Now, there's a balance, and rhetoric is different places across the state. When you talk about rehabilitation, when you talk about treatment, some folks think that's separate and distinct from holding youth accountable and community safety. It is not. Research has shown that if we engage youth, if we provide services, if we identify and meet their individual needs, if we involve families, and then we link them into appropriate services in the community, then those youth tend not to recommit new crimes, and as a result, that means that there's a reduction in youth coming back into our system. So now Malik gave you some data, and I was sitting there, I said, well, I'm glad that we're moving away from that information that he shared with y'all, because based on his presentation of the Department of Juvenile Justice, you all may start throwing stuff at me. So I'm happy to say that I'm part of a system that's working collaboratively together, because no system, no agency, no individual can tackle this here situation in and of itself. And so I believe in looking at this as a service continuum. Now, let me give you some up-to-date information on who's in the Department of Juvenile Justice. We no longer have 8 facilities with youth in them. We have 6 facilities now. Just over the past few months, we have closed 2 facilities. one down south in Murfreesboro, and then Joliet just recently closed. Now, there's some difference of opinion on whether or not facilities need to be closed. Well, when you're looking at the crisis that we're dealing with in terms of not only economics, but let me share with you what our population looks like today. Since 1985, the Department of Juvenile Justice has averaged 1,500 youth sitting in those facilities over that time period. From 1985, as a matter of fact, the lowest number of youth was about 1,100, I think, back in 1985. As we sit here today, we have 853 youth in facilities that were built for 1,500 youth. And so now economically, it didn't make sense, but then philosophically, what do you do when you got facilities for 1,500, you got less than 900 youth in? What do you advocate for? The research says that low offending youth, now understand this here, there are some youth that has done some heinous things and they're going to be held accountable. But there are some low offending youth that have come into our system that really did not need to be in there. And so what does it cost you as taxpayers? Right now, it costs $98,000 per capita per year to care for one youth. $98,000. And so when I'm asked as a director to look at cost savings and look at efficiency of operations, 98% of my budget is directed toward running a facility. And so our admonition, our advocacy is that let's right size some of that. If we don't need all these facilities, let's start to look at using dollars for treatment, using dollars to enhance community capacity and so on. And so we have endeavored to do that. So we sit here now with 853 youth. Average population since 1985 was 1,500, $98,000 per capita, 95% of males, 5% females, 1,494 youth on parole. We are responsible at this point because DOC still has a share of the parole population. But I'm happy to say that we were funded so that we can roll out our aftercare program, and within the next few months, the Department of Juvenile Justice will be responsible for not only those youth that are in the facilities, but also those youth that are on what we call aftercare. The historical term is parole. That means that we're going to not just surveil and monitor youth, but we're going to be more actively engaged in terms of giving a casework component, a family engagement component, working with youth at the front door, start discharge planning at the front door, work with families at the front door so that when those youth come back to our communities, they will come back and be linked and engaged in appropriate services. Community-based services, if you look at comparison of cost, evidence-based program tends to cost between $4,000 and $10,000. And so even economically, but you can't just say economically because you have to understand the impact of linking youth with services, jobs, vocational training, counseling, mentoring, education, and so on, the impact it also has on community safety. The average age of our population right now is 17.1 years of age. 26% are white, 62% are black, 11% are Hispanic, and then American Indian is 0.2%. So those are the numbers of youth. What do our youth look like in terms of their clinical needs or their clinical issues? 66% of the youth, and we did an assessment of it about a year ago, had at least one documentation or one form of trauma documented. So they come into us with trauma, unmet trauma needs. 30% had experienced, documented, or reported direct maltreatment. They had come to us without this maltreatment address. 37% have past or present documentation of DCFS or child welfare involvement. Typically 7 to 10% of our population are what's called dually involved or crossover youth. And it's important to understand that many of these families, many of these youth are multi-system youth. So they're involved in DMH, they're involved in the school system, they're involved with DHS, they're involved with a whole host of other systems. And so it's not just the Department of Juvenile Justice. All the systems that's involved with these families must be involved in the work that we're doing. Only 12% of these youth had what's called vocational strength. 77% had poor school attendance. These youth come with very little schooling, basically no high schools. About 3% had GED. And so it's a tremendous challenge when you got an ebb and flow of youth coming in with no type of vocational training, no type of educational training, and we congregate them together, and then our mission is to try to adjust that. And then look at this here, 33% had some actionable level of depression. So that's the population of youth that's coming into our system. And when I accepted this job, one person came up to me and said that, Director, changing the Department of Juvenile Justice is going to be like turning a battleship in the middle of a bathtub. Well, I'm happy to say that we are indeed turning it around. So what does that mean though? What does that look like? Turning it around. Everybody here knows that change is not an event, it's a process, right? And so we develop a 3 to 5 year strategic plan. And we laid out about 7 different areas that we wanted to focus on to begin to change the Department of Juvenile Justice from its historic punitive adult corrections focus to a more youth-centered focus, family engagement focus, so that we can get the outcomes. And again, this is not without saying that youth will be held accountable, and I keep preaching that because some folks get confused when you talk about rehabilitation, and they can't reconcile that youth can be rehabilitated, can be educated in the system, can receive treatment without babying them. Someone actually said to me, Director, when you take that job, don't go in there and start hugging thugs. Hug a thug. And so that's the work that we have to do to educate, to make sure individuals and organizations and decision makers understand that this is not about hugging a thug. This is about rehabilitating these youth that are going to be returning to our community. And so these are the strategic plans we outlaid effective January of 2011. We said we wanted to be part of the reduction of the population in the Department of Juvenile Justice. Again, we have done that. As a matter of fact, there became a significant decline in 2005. There was about a 7% decline starting in 2005, and as I researched it at that time, I found that was when we began to have the redeploy and the other diversion efforts. And so redeploy and the prevention and diversion efforts are working, and we need to continue with that. Secondly, we said we wanted to significantly reduce the use of isolation or confinement. Historically, again, this adult model, when a youth did something in the facilities that was considered wrong or an infraction or there was a fight, understand we need to address that. But locking a youth up that has come into our facilities with these type of clinical issues, isolating them in a room by themselves for whatever amount of time, and at times it was for days, isolating youth. And that was the punishment. Research has shown there is no rehabilitative effect in locking a youth in a room by him or herself. And then you let them out and nothing has been reconciled in terms of why they did that particular behavior and what their thought process was. There was no reconciliation process. And so one of our second tasks or strategies was we were going to reduce that. I'm happy to say that we have definitely done that in terms of the amount of time youth are spending, and we're working on processes alternative to confinement so that we can eliminate the use of confinement. Thirdly, we said that we want to make major improvements in our educational, vocational, and our treatment programs. So how did we do that? One of the things that we did, and I want to thank the MacArthur Models for Change Foundation, other individuals that was part of a work group, and they did an assessment and a report was rendered, and they said we need to have evidence-based screening and assessment instruments. We have done that. We have implemented screening and assessment instruments at the front door when these youth come into our reception and classification centers so that we can identify what are their strengths and needs, and from that then we can begin to develop treatment and individual programming and discharge planning for those youth. Vocational enhancements, I mentioned that. Let me talk briefly about our educational efforts. We are the first state in the nation that has implemented what's called an online educational enhancement, or AKA virtual high school in a locked facility. That's very important, and it does not negate the need for human educators. But what it allows now is for us to have more flexibility for those youth that are coming into the system at various times. They come in with various educational levels. Now these youth can not only begin to do their educational renderings in the facility online, but then when they return to the communities, they can continue that education. And we're working collaboratively with the city, the county, and others so that we can have a location, so that we can have some support, so when those youth come out, regardless of what level they are, they can then tap into this online educational enhancement program, virtual high school, and continue their education. And then we're also working on efforts that not only do you continue your education and you continue your vocational training, but you get actually linked into some work training. And so those are some of the things that we're doing. Then we developed and have developed over the past couple of years a pilot program in Cook County. It's our aftercare program. Again, this is the program where the youth have caseworkers that are operating in the dual role of caseworkers, case managers, and also parole agents. But I don't want to use parole agents to confuse folks, because their focus is engaging families, engaging community-based providers, linking youth with services, following up, and then as opposed to immediately rearresting youth when they may violate probation, we have what's called graduated sanctions. Because we know that we can't just, if a youth is past curfew, we're not looking to rush a youth back into the facility. Or if there's some other infraction. Now there are some things that you're going to come back. But for the most part, we're looking at giving youth the opportunity to change, giving families an opportunity to become involved, giving community-based providers an opportunity to work with these families and so on. And then lastly, our data system was archaic. We actually had a data system, that's considered like the 1984 Atari game. Anybody know that game? That's actually how our data system was operating. Our information was not real time. It was 30 days old. We really couldn't communicate with other systems, and I'm happy to say that we are in collaboration. The Juvenile Justice Commission, has assisted us. The MacArthur Foundation has assisted us. DOC has assisted us, and we are working and looking forward to a modernized data system that can allow us the opportunity to case manage, to do screening and assessment, and also to communicate with other community-based providers and other state agencies. And then lastly, so that I don't go past my time, the two presidents, and I like to quote this here, two late presidents, John F. Kennedy and Herbert Hoover, said the same thing basically. They said that our youth are the world's greatest natural resource. And so we ask the question, just because they end up in the Department of Juvenile Justice or the county detention program, does that mean that they are no longer valuable? They are still valuable, and they still can be valuable. Thank you.